Live Jump with Anita Bradley.
And good evening, everybody. Welcome to Live Talk with Benita Bradley. I'm your host, Benita Bradley, and I do hope everyone is having a great evening. So tonight I am working with my iPad because my computer is still acting unruly for some reason. So let me just make sure I can get my camera situated. If this is a good angle, you guys let me know in the comments that this is a good angle. I have a special guest with me tonight, so I don't want to keep her waiting. Um, but unfortunately, when you're doing live, this happens. So thank goodness the I have the ability to grab other devices, and here we are. Good evening, Facebook, all of you. Good evening, Periscope, Twitter. Good evening, YouTube, and good evening, Instagram. I hope everyone has had a wonderful day. It's the beginning of the week, and I do hope your week is off to a wonderful start. Um, let's see. Y'all tell me if this is a good angle for me. My guest tonight is, we call her affectionately Ma Beverly, but I'm going to let her introduce herself in a minute. Let me make sure it's a good angle for everybody. Somebody say no, it's not a good angle. All right, let me see. Um, let's see if I turn it this way. Is this a better angle?
Yes.
All right. All right. This is better. Okay. All right. So let's see. Okay, let me move that out the way. Um. Let's see. Okay. You guys say this is a better angle. But it doesn't work for me. Instagram, I know you guys are okay. Is this angle good for you guys? You're on the same device that you're always on, so you guys are good. Ma Beverly, go ahead and introduce yourself. I'm still going to work on my angling some more.
Okay.
Why don't you introduce yourself?
Okay. Well, good evening, everyone. I am Beverly King. As Pastor Benita said, I'm affectionately called Mama Bev or Mother Bev. I am a mother, a grandmother, a registered nurse for over 20 plus years. I'm into project management. I write. Haven't authored any books, but I do
Yes.
write yet. And I also design jewelry, and I make floral arrangements and different crafty, unique items.
Oh,
Um,
okay. We got to get some of those on the show so we can
okay,
show your work. Yeah, we got to show your
okay,
work. Definitely. So, Ma Bev, tonight we're going to talk about your journey with COVID. You called last night and you shared your journey with me, and I have been trying to get people that have actually experienced COVID to come on the show, but for some reason, I don't know if people are afraid to share their story or they don't understand how important it is that we share our story so that it may help someone else understand that there is life after COVID. You can have it, you can recover from it, and you can progress along the way after having COVID. And um, so we want to get right into it. I'm not going to hold you long tonight. Um, because I'm still cooking all this food for my meal prep when I go to
okay,
have
okay,
surgery on Wednesday. Um, I want to talk a little bit about that, but I want to get your story in first
okay.
um, because I do know you're still convalescing at home. And there's still a few issues that you're dealing with even after getting better with COVID. And a lot of people doesn't understand sometimes COVID can have long term effects on certain parts of your body, particularly your lungs and other vital parts of your body. So why don't you? I'm gonna let you take over, and I'll jump in, ask questions here and there. But tell us when you first realized you had COVID, or did you even know you had COVID?
Well, I did not realize initially that I had COVID. I spoke telephonically to my primary care physician,
Mm-hmm.
and being that I'm a nurse, I'm trying
Mm-hmm.
to self diagnose
Okay.
and thought it was bronchitis.
Okay.
So I was prescribed some medication,
Mm-hmm.
didn't get better. So I
Mm-hmm.
called again.
Mm-hmm.
It was almost maybe 3 days later.
Okay.
This doctor said, "Are you sure you don't have COVID?" I'm
Mm-hmm.
like, "I don't think
Mm-hmm.
I have COVID. I mean, I do have the difficulty breathing, but I did not have the headaches. I didn't have the fever. I did not have the lost sense of taste or
Mm-hmm.
smell or anything like that." So, for me, no. He said, "Why don't you go get tested?" So I went and got tested
Mm-hmm.
on August the 18th, and my
Mm-hmm.
test came back positive.
Oh.
So he said, "Okay, stay at home,
Mm-hmm.
quarantine, use your inhalers, and we'll see what happens."
Mm-hmm.
So a few days go by. I'm still working as a case manager,
Mm-hmm.
and I'm still having, difficulty breathing.
Mm-hmm.
So it got to the point that one day I was sitting in my room
Mm-hmm.
and I literally couldn't move.
Oh.
I was just sitting there. I couldn't even get up to go to the restroom.
Mm-hmm.
And that's when daughter said, "This is something more serious. Let's activate 911." So when
Okay.
the paramedics arrived to my home, I only had 37% oxygen within my lungs.
Mm. Okay.
So got en route, got scared. I panicked because I'm talking like
Right.
I'm talking to the audience right now.
Mm-hmm.
Got to the ER. My lungs only had 25% oxygenation saturation, which
Mm-hmm.
means basically all of your other bodily organs are beginning to not really shut down, but systemically, they're not getting enough oxygen because the body is depleted. So things begin to, turn for the worse. So
Mm-hmm.
they're speaking, ventilator and everything else. And I'm like, "Oh, no, 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 no. Beverly
Mm-hmm.
King, not Beverly King. We're not doing that." And so I ended up on high flow oxygen.
Mm-hmm.
I was in ICU for a period of 9 days. No, six
Okay.
days.
Mm-hmm.
6 days.
Mm-hmm.
And all the doctors could say is, you know somebody. You weren't supposed to be here. You was on your way
Mm.
out.
Wow.
And this was spoken to me the night that I got there in the
Mm-hmm.
ER. There were like
Okay.
20 doctors in the room, and
Mm-hmm.
everybody's asking, "How is she talking? Why is she this
Mm-hmm.
alert?
Mm-hmm.
How can she know everything that's going on?" And that's what it is with COVID. You can It's like hypertension. They
Mm-hmm.
call hypertension the silent killer. And
Mm-hmm.
we can be talking and
Yep.
you thinking you're getting air
Mm-hmm.
within your lungs,
Mm-hmm.
but you're not. And you can be talking the 1 minute, and then the next minute you could be gone.
Wow. Wow. Hold on a minute. So I want to make sure that everyone on Instagram can hear my Beverly as she's telling her story of survival with COVID. Now, you guys can't see her on Instagram, but let me know in the comments if you can hear her. Okay, I think I have the volume up. Uh, let's see. Hold on. Okay, so Instagram, let me know if you can hear her okay. You should be able to hear her okay because I have you guys positioned relatively close to my iPad since we're not using my laptop like we normally would. So just let me know, says yes, we can hear, or no, we can't hear, but you should be able to hear, okay? All right, thanks. So when you first started feeling bad, in your mind, you just thought, okay, this is
Bronchitis.
bronchitis. Were you coughing? Were you?
I was wheezing, I was coughing,
Uh-huh.
um, more so um, just shortness of breath, but
Okay.
it would come and it would go, it would come
Okay.
and it would go. So,
Uh-huh.
I would use my inhalers. I have two, and it would
Okay.
subside for a while, and then it would
Okay.
just flare back up. And I'm like, well, this is strange. This
Mhm.
doesn't happen with bronchitis, not with my history.
Okay. So
So,
you have a history of bronchitis.
yes,
So this was kind of par for the course. You kind of understood, oh, this is just another flare up.
yes,
Okay. 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 So that's what you were thinking at first.
yes.
At what point did you realize maybe this is not bronchitis?
When I got to the point where I literally could not stand up
Okay.
or move, I knew this was something way more serious, but still not thinking, this
COVID.
can't be COVID.
Oh, okay. Okay. So why in your mind, probably because you're a nurse and I told you last night, nurses and doctors makes the worst patients because
Yes,
you
indeed.
all you all immediate. Oh, I know what's wrong with me. so so was it that mindset that made you think, no, this can't be COVID because I've been careful. I follow the CDC regulations. All of that. I wash my hands. I wear my PPE. I do everything I'm supposed to do. So in your mind, this is just now. Last night you were telling me you normally get these bronchitis flare ups like once a year,
Once a
maybe.
year, maybe once every other year.
So you kind of was familiar with everything that was going on,
Hmm.
but then that bronchitis kind of took a turn and fooled you.
Yes, it did. So,
Uh-huh.
my advice to everyone is, even if you think it's something that you're familiar with,
Okay.
don't count it odd that it could be the coronavirus, because it affects people in many different ways. Like,
Uh-huh.
I never got the fever, I never got the nausea, the vomiting.
Mm-hmm.
I never, some people break out in hives or they
Mm-hmm.
begin to swell up. Well, the
Mm-hmm.
swelling came after the fact.
Okay. But
So,
you say you never lost taste or smell either.
no,
You never
not at
ran
all.
a fever.
Mm-mm,
Okay.
not at
Okay.
all. Which was so, for me, hearing all the stories as a nurse, I
Mm-hmm.
found that quite odd.
Okay. Okay. You found it odd that you didn't have those symptoms?
I did not, yes, I found it odd because most people do, especially when you're at my age. I'm over 60. I have comorbidities. I have,
Mm-hmm.
of course, you see, I'm a big girl. So,
Mm-hmm.
that's number one. That's against me.
Right.
I have hypertension.
Mm-hmm.
So, that's working against me. But
Mm-hmm.
everything else, I'm okay. For me to be a big girl, I'm pretty healthy. I don't
Okay.
have diabetes or anything, serious like that. So,
Mm-hmm.
it just kind of threw me off.
Mm-hmm. Mm-hmm. Now let me ask you this, my babe, and I want you to be as transparent and as honest as you can be. Were you afraid when you tested positive?
No, I was not.
Okay. Okay. Because I hear a lot of people get afraid. They, like you said, we start to consider our own morbidity at that point because we've heard so many stories about
Hmm.
people not recovering um,
Hmm.
from COVID. And if they do recover, their lives are never the same. So when you
Absolutely.
tested positive, what immediately came to your mind?
Am I going to live?
Okay.
After I got to the hospital and listening to several different doctors tell me what was going on,
Mm-hmm.
my concern was, am I going to live? Is this the end for me?
Mm-hmm.
So, at that point, you do get scared.
Okay.
but yes, I'm a believer,
Right.
all of that, but
Right.
still, you get to a point that it becomes stressful. It becomes so emotionally overwhelming that you just can't grasp that
Mhm.
this is happening to your body.
Right.
That your body is not doing what it's supposed to do. It's not
Mhm.
restoring quick enough. So,
Mhm.
you begin to, wonder,
Mhm.
you know, um, you begin to question God. Some people,
Mhm.
I had a roommate that actually, questioned God. Why me?
Mhm.
I haven't done anything wrong.
Yeah.
What is it? Why do I deserve this? But
Yes.
my thing is, all along when the pandemic started, being healthy, being cognizant of the environment, taking the necessary precautions.
Mhm.
When the second wave hit, my ideology it changed to
Okay.
when am I going to get it?
Oh. Okay.
So
Okay.
when is my turn?
Right. Right.
So
Right.
when I started thinking in that manner, of course, me being a nurse,
Right.
I'm going to do the elderberry, I'm doing the turmeric, I'm doing the sea moss, I'm
Mhm.
doing the beetroot, I'm doing everything that I can to
Okay.
boost up my immunity. I'm taking
Mhm.
your vitamin C and your zinc, and all of that, but yet I still got it.
Yeah. So in your mind, like we're going to talk about the physical part, but hearing that you have it, what emotions start to come over you? I understand that um, your own morbidity at that point kind of kicks in, but like emotionally and psychologically, what battle are you immediately starting to fight when you hear that?
Well, the thing that got me, yes, you had your staff there, but I was just afraid of being alone.
Mm. Mm-hmm.
Um, you know, I couldn't talk on the phone that long because I was just so winded.
Mm-hmm.
And you think about, am I going to be able to tell my loved ones if this is it,
Mm-hmm.
that I love them and
Mm-hmm.
I'll see you on the other side. But outside of that, you get anxious,
Mm-hmm.
you
Mm-hmm.
grow weary, and you
Mm-hmm.
become very fearful.
Okay.
It got to the point that, when the doctors come in, it's like, what are they going to tell me now?
Mm-hmm. Mm-hmm.
What's next? Am I improving or am I failing?
Right.
So, it was just, you're scared and you begin to have that battle in your mind,
Yes.
you know.
Yes. I
So,
know what battle you're talking about. Trust me.
okay.
I I know.
Mm-hmm.
So when you got to when you went to stand up, was that before you got the COVID test or after when you couldn't stand up?
This was after the test.
Okay. So what made you take the COVID test?
My doctor called me and said, you need to go.
So
And,
he thought
I
maybe
take
it
his
was more than
word.
bronchitis.
Yes. Yeah. He
Okay.
told me, you need to be tested.
Okay.
I'm
Okay.
like, okay, I didn't want to go, but I went.
Let me ask you this: why didn't you want to go? You're a nurse. Why didn't you want to go get tested?
Well, I got kids at home. I could self-test myself, and they always came out negative.
See, this is what I'm saying. You doctors and nurses are the absolute worst patients, my man.
Yes, I test myself, and it always came out, negative. You're
Right.
like, are you doing it right? Yes,
Mm-hmm.
I'm positive. You can watch me do it.
So the last time you tested yourself, and then you tested positive, how much time had was between those two tests?
Oh goodness, probably like 5 days.
Okay. So when you did your last test at home, it was negative.
Hmm.
5 days later, you tested at the hospital, your doctor's office, or what?
I went to one of those drive-up clinics.
Private clinics. Okay.
Hmm.
And then that test came back positive.
Positive.
So could it be that you may have been testing yourself wrong? Or
No, No, and
Did
the
you
only
contract
reason
in
the
between that?
no, no, see, the incubation period
Okay.
can take 10 to 14 days.
Okay.
You can test negative from day 1 all the way to day 13.
Okay.
And day 14 you're positive. It just will
Oh,
not,
gotcha.
it will not show up because it's not, number one, it hasn't, it's there, but it's so far down in the lungs, it has not had the ability to come up and get into the nasal pharynx, in the back of the
Oh,
nose
okay.
and into
Okay.
your nares.
Okay.
Hmm.
Okay. So then it wouldn't show up
Right,
right
it would not
then.
show up.
Okay, I understand. I understand. So then you get tested, and you did you go to the hospital immediately after you tested positive?
No.
So how long were you able to stay home after your positive
18,
test?
23. 6 days.
6 days. Okay, and so 6 days after testing positive, you go to stand up and you can't get up.
I could not get up. I just sat right back down
Mm-hmm.
because it just took so much energy to stand up that caused me to have um shortness of breath like I've never had before. I
Mm-hmm.
mean, it was worse than a lady in labor.
Ooh.
She's in her transition and she's panting, and I'm
Mm-hmm.
panting. I'm like, where's this air,
Yeah.
coming from? And I could not
Yeah. Yeah.
get
I,
it
I
in there.
saw
So
that.
that's
I saw that. It's like a hyperventilation state.
yes.
Yeah, when my daughter passed,
Mm-hmm.
I was there for all of that she went through. So I know how scary that looks. I know how scary it is, and I can
Yes.
imagine the mental pressure.
Yes.
The mental battle. Okay, am I going to breathe? Am I going to not breathe? Like I can only imagine the mental anguish that you're going through while you're trying to breathe but can't.
But you can't see. That's when you start thinking, being that I'm in healthcare, I
Mm-hmm.
know what's happening to my body. So that makes it all the more scarier.
Mm-hmm. Mm-hmm.
So I'm
Because you've
like,
seen
Lord,
this
please.
before. You've seen
Yes.
this, just not with you.
Yes.
Okay. And so then you get to the hospital. Um, are you in ICU? Where are you when you
I
first
was
get
in
to
the
the hospital?
emergency room,
Okay.
and then I was transferred into ICU,
Okay.
and then went to a semi-private room, then a private.
Okay.
So, but the majority of the stay was ICU.
Okay. And while you're in ICU, what's going on with you, if you can
And
remember?
I was improving. I mean, the oxygen levels kept improving. They did not have to use a BiPAP or CPAP machine. And they
Mm-hmm.
just kept telling me over and over, you're one of the best patients that we have. You're improving the
Mm-hmm.
most. You're
Mm-hmm.
doing so good.
Mm-hmm.
But it's just taking you a little bit longer because, number one, you're older
Okay.
for you to bounce back.
Okay.
So I'm like, okay, God, He spared my life.
Right. Right. So was it at that moment you start feeling like, okay, I'm gonna make it through this,
Yes.
or did you still have those high and low moments emotionally? You know.
No, they actually subsided um, once I started trending downward with
Mm-hmm.
the oxygen that I was receiving, because I started out with 100%.
Okay.
I mean, full blown oxygen, 100%.
Mm-hmm.
And when they got down to 15 liters, I said, okay, we're
Mm-hmm.
getting there. We're making progress.
Okay.
Got down to 8 liters. I'm like, okay, we're doing good. And when they turned that thing down to 2,
Mm-hmm. You knew you had made it, huh?
I knew I made it. Yes. I knew I made it. But, the goal for them was to discharge me home without the need of oxygen.
Okay.
So when it came time for me to take the exercise test,
Mm-hmm.
I couldn't even begin to walk when they took the oxygen off of me.
Mm-hmm.
My saturation just started going down, 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 down.
Mm.
So I think it was
Now
the
this is
third
after
attempt,
you thought you were out the woods.
I thought I was out of the woods.
Okay.
So they said, no, let's wait another day.
Okay.
So we made it up. We walked in place. I couldn't even walk forward. It just let me kind of like run in place.
Mm-hmm.
And my oxygen again started going down. It got to like 89%. But if I
Okay.
was walking, it could have depleted any further.
Further.
So we
Okay.
might, no, you're going to have to go home on oxygen. I'm like,
Mm-hmm.
okay, no, no big deals.
Mm-hmm.
It's temporary.
Right. That's
So
what you were. This is what was going through your mind. These were your thoughts. Okay, this is just temporary. I'm gonna go home, need a little oxygen, whatever, and then boom, I'm gonna be back to normal.
yes,
And then after that, how many days total did you wind up staying? Were you in ICU the entire time?
no, my whole stay was 11 days.
Okay,
I believe it was like 6 or 7 in ICU
and then the rest you were in a regular
in a
room.
regular room.
So in that entire time, were you on oxygen the whole time?
The whole time.
Okay.
I had it on even coming home.
Oh, really?
Yes. I had my
Okay.
portable tank and
Mm-hmm.
we took it all the way home.
Okay. And when was that? When did you get released from the hospital? When did
It
all this
was
transpire?
it was September the 3rd, right before the Labor Day holiday.
Okay, so you've been home just over a month now, and
Yes.
you look incredible, and you sound
Praise
really
God.
good. Yeah, you look
I've come,
incredible.
a long way. I tell people all the time, I don't look like what I've been through. Granted,
Absolutely.
I do have some long haul
Okay.
things that I'm still dealing with that is progressively getting better,
Okay.
but I'm more cognizant of not pushing myself because, if it was Beverly King,
Right.
Dr. King, I would have had my behind back at work
Right.
two
Right.
weeks ago and
Yep.
probably back in the hospital.
Yep. Absolutely.
Probably back in the hospital, scared, and the clots that I have in my legs could have traveled and I could have got,
Yep.
a stroke or a pulmonary
Yep.
embolism, God forbid. And here we go again, a longer hospital stay. But
Yeah. Now,
um,
did you have the clots before COVID or after
this
COVID?
this happened during COVID.
Okay, so blood clots is that something normal that people can or should expect to happen along the
Well, it
course
is
of this
known.
COVID thing? It's
Yes,
known. Okay.
yes.
Okay. Wow. So you go home September what 3rd,
hmm
but you're still on oxygen.
I kind of took myself off. I will be honest with you. Um, Once I got to the point that I was able to walk to the restroom and come back without my walker, and I'll
Okay.
test my oxygen saturation level, and it's still in the upper 90s. I'm
Uh-huh.
like, Okay, let's try another day. I went to sleep,
Mm-hmm.
wake up during the night, test it. It's still in the 90s. I'm like, okay, get
Mm-hmm.
to the primary care doctor. No, we need you to keep your oxygen tank just in case you need it. I'm
Okay.
like, oh gosh, I want to go back to work. I don't want this oxygen.
Right.
So, me and my fast self, you know me,
Yep.
I kind of pushed myself to the limit too far,
Okay.
and I took a step back. So
Oh.
back came on the oxygen because my levels had dipped down to like 75%. So I'm
Okay.
like, no, 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 no. Let's put this back on. Let's turn this up to 5 liters. Let's
Mm-hmm.
get this going
Mm-hmm.
and call your doctor and let them know what's going on and just
Mm-hmm.
continue to wear it.
Okay.
But now you see, I don't have it on. I'm back in my 90%. So,
Yeah.
but
Yeah.
I didn't turn the machine in. I still have it.
So like in your mind, like, and it probably was the nurse in you that said, girl, you don't need this. What made you really think that it was time for you to become Dr. Beverly to Nurse Beverly? So I'm just wondering, like, what told you to do that?
Well, because, oxygen is good, but too much oxygen, if you're standing at 95% and higher on room air, can be bad for you too. So I
Okay.
knew what to look for. I did not want, my family to see, anything respiratory going on.
Hmm.
So, we took it off. But I did finally tell my doctor that I took it off.
And did your doctor say? What was
He
that
was fine.
conversation like?
He was fine.
Oh,
He know that Beverly King is going to do what Beverly King want to do. But
listen,
this last time he told me, he said, I know you, but I will make a house call just for you. I'm like,
yeah.
oh, no, you're not. He
Hmm.
said, oh, yes, I will. So I'm like, okay.
Even if you have to super glue your oxygen mask on or
Yes,
something.
ma'am.
Now,
It got
last night
so
we were
funny that
talking.
I have a grandbaby. She's
Hmm.
4 years old. And when my daughter would bring her home
Hmm.
from school,
Hmm.
Grandma, where's your oxygen? You need your oxygen to help you
Hmm.
breathe. She would run and get it and put it on my face.
Now, let's talk about your family. I think you told me everyone in your family had it,
Yes,
including the
everyone.
baby.
Yes.
So, how did they do? How did they come through all of it?
They were
Did they get as
asymptomatic.
sick as you?
They were both asymptomatic.
Okay, okay, okay.
Now
So,
my daughter, she had some initial, symptoms, where she said it felt like it was gas,
mm-hmm.
and that was actually the COVID. The
Oh,
because you do have the chest pain sometimes.
okay. Mm-hmm.
Hmm.
And is that from like the pressure on your
It's
lungs? Or,
it's the inflammation. The
okay.
biggest thing with COVID is that it inflames every organ in the body.
Oh, okay,
Hmm.
okay, okay. That makes sense, more
Hmm.
sense to us.
Hmm.
So, if you could, you were telling me something you were telling them to do in the hospital because you knew so much medically that they were actually um, questioning, like, how did you know that? Are you in healthcare? Who are you, lady? you know.
Yes, well, of course, the hospital, it was set up with my chart. As soon as the results hit, I get a text message and I want to check. I want to know what's going on, but you might not tell me everything, or you
Right.
may not be truthful.
Mm-hmm.
So we called him Dr. A. I cannot say his name to save my life.
Right.
And we were in there, chatting, and I questioned him. I'm like, well, my D dimer test is elevated.
Mm-hmm.
And that means that the blood thinners that you're giving me is not enough.
Right.
Don't you think you need to increase it? He said, well, he looked at me like, how'd you know that? And I had to break down, well, I'm a nurse.
Mm.
I finally
Okay.
broke down. This was like day 8.
Mm-hmm.
I finally broke down. He said, I figured you were something. You knew too much.
Right.
So he said, but we were going to talk about that. Yes, that's why I'm here. Is,
Mm-hmm.
to let you know that, don't no cause for alarm, but we need to increase your dosage.
Okay.
I'm like, okay.
So looking back, did you go through your mind, try to figure out, okay, where did I contract? Where did I come in contact? Where could I have been exposed to this virus?
Well, that's the sad thing because, you know, um, you could have been exposed anywhere. It could have been work. It could have been, school was back in at the time.
Mm-hmm.
People were exposed, within the schools, bringing it home. But, if
Mm-hmm.
y'all go to Kroger, Walmart, restaurant, you know, you can get it anywhere, not only COVID, but other things.
Okay.
So, you know, sometimes, I've gotten a little not really complacent, but I guess a little negligent because, I'll go and then the next thing I know, I'm opening the car.
Mm-hmm.
I haven't cleaned or sanitized my hands,
Mm-hmm.
and my hands go straight to my face,
Mm.
or they push up
Okay.
my glasses, or they're, my ears, or,
Just
my
something
mouth.
we do out of habit.
Right. So
Yeah.
well, it's too late now. Whatever's there is done.
Right.
I can't do anything,
Right. Right.
So you
So
go
would you
home
say
and
that we have to develop an entire new level of consciousness as long as these variants of COVID are still out there, and then we have new variants of COVID still
yes,
coming up. So I
yes,
guess we would have to then develop an entire new level of consciousness, washing hands and remembering not to touch face, particularly when you're out in public. Don't touch
Right.
your face. You
Right.
know, I can imagine once you get home, scrub, 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 and you're in
Right.
your
But the thing of it
safe
is, you need to
environment.
wash your hands long enough. I tell people to sing the happy birthday song or the ABC song and
Okay,
really and scrub. Just don't, 15 seconds and be done. No,
okay, okay,
that's not going to cut it.
okay. So does it matter um what kind of soap it is? Does it have to be like an antibacterial soap or
Well,
any soap?
there's so many conflicts
Right,
regarding antibacterial soap and if
right.
it's, better, if it's doing anything. My thing is soap is soap.
Okay,
If you're scrubbing, 30 seconds, a minute, you should be fine.
okay, okay.
If not, use hand sanitizer, but make sure that it's at least 70% alcohol in your hand sanitizers.
So were you always cognizant to wear your mask in public? Let me ask you that.
Yes,
Okay, okay.
always
So,
wear the mask. I didn't do the glove thing, but I've always wore the mask. I kept sanitary wipes in my car and hand sanitizer.
mm-hmm,
And if I
mm-hmm,
could wash my hand before I leave a facility, I would do that.
mm-hmm. Now
And not to. Mhm.
let's talk about last night. We talked about transferring because many of my viewers and followers know I'm getting ready to go. And a matter of fact, this week, Wednesday,
Yes.
for another brain surgery.
Hmm.
And you were asking me, well, basically about home health care after I come home, because I am home by myself during the day, uh, you know, quite a bit.
Hmm.
And we talked about that, but we also talked about the scary part of having nurses come into your home because they're not always cognizant. You don't just need to change your gloves, but you need to change your mask and your gowns
Right.
because all of those could be carriers of germs, diseases from one patient to another.
Or either it isn't one patient to another, or even from me to a surface.
Okay.
Because if it's a table, any type of surface, and that
Mm-hmm.
bacteria is on me,
Mm-hmm.
depending upon what it is, that bacteria can
Mm-hmm.
live on that surface for a
Okay.
long period of time. Just like the COVID, when you're coughing, the droplets linger in the air for
Mm-hmm.
11 plus hours. So it's not that it's not present, it's
Mm-hmm.
present. You just don't know it's present.
Now let me ask you this: in your most honest opinion, do we talked about this last night, but I want the audience to hear it from a nurse. In your most honest opinion, in your most honest guesstimation, are home health nurses taking the precautions that they need? Do you think that they are willing to invest a little bit more to have extra gowns, extra PPE, extra gloves, extra mask, whatever they need? Do you think that they are doing what they need to do to keep each patient
Well,
safe?
I have a two-part answer to that.
Okay.
The first part is they're following the guidelines, whatever their employer mandates,
Okay.
which is
Okay.
usually following CDC protocol and the OSHA guidelines.
Okay.
But if I were to be really, really honest,
Mm-hmm.
um, and because I'm a nurse and I know what's going on,
Mm-hmm.
I
Mm-hmm.
would say they need to do more and they need to advocate in
Mm-hmm.
saying that this is not the correct protocol. If I'm going to go from one patient's house to the next patient's house and I can use my same mask and
Mm-hmm.
gown, I can change my gloves and my foot slippers and all of that, but I'm going
Mm-hmm.
to keep my mask because most of them are wearing the N95 and
Mm-hmm.
I'm going to keep the same gown on. Well, you
Mm-hmm.
just cause cross contamination. Whatever
Mm-hmm.
was in the one home, you have now brought it in to the next person's home.
That's interesting. And I know for a fact I am not the only one that did not know that. You know, that is most interesting, and it's a little scary,
It
particularly
is
for
because,
someone who may need a home health nurse for a little while at least.
well, if they're using gloves,
Hmm.
for everything, you're kind of okay.
Okay.
But my thing is, if I, have my gloves on and say, what's the name? I mean, listeria is out there, salmonella is out there, and
Hmm.
they're not properly. I don't know how you clean your meat, but I know how I clean my meat.
Right.
And you might not be as sanitary, and I'm in your space. Most people,
Right.
when you're meeting, you're there, in their dining room. You're usually
Hmm.
hardly ever in the bedroom because that's your sacred, place. I
Right.
wouldn't want nobody in my bedroom either. So,
Right.
you're there,
Hmm.
and you can't see anything. And if I just rub my gown, and I'm coming up to you and say you needed a dressing change, I might brush up against you.
Oh, okay. So
And
that's
then
where
where
the
I brush up against you, you
contamination
may
comes
you
in.
may touch that area.
Oh,
Okay.
okay.
And then if your system is already immunocompromised and
Hmm.
you touch an open area on your skin, or
Hmm.
your again any open area on your face,
Okay.
there is the room for that bacteria to come on in and invade your system. That's why you
Wow.
see so many people, when they relapse and they have an infection
Hmm.
and they become septic. It's because sometimes somebody then brought something in, if they're receiving home health care, or they were discharged too soon from the hospital, or they did not get the proper care in management and treating an open incision. There's so many things. And I tell people, if you can, when you're going into the hospital, yes, they clean, but
Hmm.
bring your own sanitizer,
Hmm.
bring your own wipes.
Hmm.
You can't have anybody there, but if you have enough strength to wipe down your side rails, your lap table, do all of that every day.
Hmm.
And that's going to keep the temperature in the room cold.
Hmm.
That's going to deter the or decrease the amount of bacteria that is floating around within the room.
Okay.
So, you can never do too much.
Too
This
much.
is this is your safety.
Right. Right.
If I was your nurse and walking in there, I want you to see me
Right.
wash my hands down my glove. Granted, I'm going to have some of my equipment on, but I want you to
Right.
see me literally wash my hands.
Right.
And that's
Right.
going to give you a sense of security that, okay, she's protecting me and herself as
And
well, but
herself.
all of your loved ones.
Yeah. Yeah.
Hmm.
Yeah. So going forward now, do you have any lasting um, ailments? Is there anything that hurt you other than you may from time to time have to use your oxygen a little bit? Anything else? Has any of your other organs been damaged by COVID?
To my knowledge, no.
Okay.
I'm not sure as far as my lungs. I do have to see a pulmonologist because mine was so severe that there
Mm,
could be, scar tissue or something that's there. I don't know. Um, every now and then, I may get a wheeze, or if I'm running too fast,
mm-hmm,
I might get the shortness of breath.
mm-hmm.
But I still have swelling in my lower legs and my feet, but they're
Okay.
going down, thank God. But
Yeah.
that's something long term. Right after I came home, for about maybe 5 weeks, I had what they call the COVID cough.
Okay.
And I just cough, 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 cough. Like, I still had COVID, which I know I didn't,
Right.
but there was no medication that controlled the cough.
No cough
And
syrup, no Robitussin, none of that.
no, no, I had a godson that had the cough for a year.
My
It's like
goodness.
a whooping cough. It's just a hacking cough.
Mm-hmm.
And then eventually it will go away.
That has to be not only physically draining, but mentally draining as well.
It is
Because it's
because you
totally out of your
always,
control, right?
yes, because you're
Mm-hmm.
thinking the first thing is, well, did I relapse? Because people do,
Oh,
people think they get it one time and that's it. No, you can get it again.
okay.
It's just like people with the vaccine, fully
Right.
vaccinated. You can still get it and die. But
Right.
what you hear is that they transition due to some non COVID complication or
Right.
some other comorbidity
Right.
or pneumonia.
Right. Or underlining
Yes,
issue. I do want to mention General Colin Powell. You know, um, of course, we knew that he had Parkinson's, and I think he also had cancer at one
I
time.
think so.
And so he had comorbidities as well. So in those cases, he probably could have recovered, you know, if not for those other
Other
comorbidities,
conditions.
yeah, that he was
Absolutely.
fighting. Um, and then his age. But I do know people who are older that have had it and recovered. I think you said your dad had it
My dad had it,
and he
95
recovered.
years old, and he's doing better than me.
Oh wow.
Yes, he's still out there in the garden pruning. I
Mhm.
mean, you tell him to do it like any other young person would do it,
Mhm.
and he would do it. It might take him a little bit longer, but he'll
Right.
do it.
So was he hospitalized as well?
Yes, he was hospitalized and then had to have rehabilitative support afterwards for about 8 weeks.
Now, for what? Rehab for what?
Well, it was being that when he went in the hospital, he became deconditioned. He didn't have any endurance or strength, which
Okay.
was what happened to me. That's why I required occupational therapy and physical therapy. I didn't even have the strength. So, they start off, trying to get you to even just push up without getting out of breath. So, it took a lot for him,
Mhm.
but he did bounce back.
Wow. And then the baby and your daughter, they're doing well.
Oh, they're doing fine.
Okay. Okay.
Hmm.
So are you able
Well,
to walk at all now on your
I
own,
am
or
walking, praise God, without my walker.
oh
I have not
amen.
attempted the steps,
Okay.
so I will wait until I get direction from my doctor or physical therapist
Okay.
before I be Dr. King again.
Right. So have
Because
we had
look,
a
I
good
can't
time?
relapse no more. I can't relapse. I got a birthday coming. I want to eat some cake.
Yeah, you do have a birthday coming up, if I remember correctly. You
Yeah.
definitely do. So how are you feeling now?
From whence I started to now,
Mm-hmm.
I am 100%, 1000% better.
Mm-hmm. Mm-hmm.
I am just so overwhelmed of how fast I recuperated that
Mm-hmm.
I just want to, jump leaps and bounds and do
Yeah.
everything. But, I have learned that just because I feel well doesn't
Okay.
mean that I can do what I want to do.
Now
So
that's
I
something
did
I'm
learn my
still
lesson.
learning. Yeah, I'm learning that.
Yeah.
That you know me. As soon as I feel well, I'm up
I'm,
out the
I'm out. I'm
bed.
out.
I'm gone.
And that's me. I'm gone.
Yep.
I don't be still. Don't take my daughter to talk about me.
Yep.
But I can't, I just can't sit.
Yeah. Yeah.
I gotta do something.
Yeah. It's difficult when you're not used to having those restraints put on you, but then you realize it's necessary to maintain some degree of healthiness. And if you want to recover, like you said, without having those setbacks, this is what we got to do. We got to do what we
Right.
got to do, and we
We
got to
gotta
do it
do.
now. You know.
Right. And see, the one thing that any healthcare professional will tell you with COVID is that you can't let it get the best of you.
Okay.
I mean, if you can exercise and walk, get up. Do not stay in that bed.
Yeah.
or if you are in the bed,
Mhm.
do some exercises. You can
Mhm.
lift your arms, you can grab a couple of canned goods and lift and do
Mhm.
different things. You can point and flex your feet. There's
Mhm.
things that you can do that could, get the body flowing and going. Because,
Right.
once COVID is there, it's still swelling and it's so thick
Mm.
that, you want to move. Because if you don't move, you could die.
Yeah. Yeah.
Even
And
with the oxygen, you could still die.
you can still die. Yeah.
Hmm.
Because like I said last night, we were talking, and I was saying you can live with a heart condition. I'm proof positive you can live with brain tumors, but you cannot live if you cannot breathe.
That's right.
And I think that's what we need to really hone in on this entire COVID thing, is that if you cannot breathe, you cannot live.
That's right.
Yeah.
It takes only 4 minutes,
Hmm.
4 minutes
Okay.
without oxygen to your brain or heart that the tissue begin to die.
4 minutes.
4 minutes. That's not a lot of time.
That's not a lot of time. And that kind of took me back to, we were watching, all of us across this world and abroad were watching the George Floyd case, and they were trying to say, oh, it was this, that, and the other. But the real thing is, you cannot live if you cannot breathe.
Breathe.
and
Absolutely.
and that's what I saw a lot of videos of people kind of giving their deathbed, um, um, not confession, but their deathbed uh, videos with COVID, and it was horrible to watch. Absolutely
Hmm.
horrible. And people were crying, "Don't let me die alone."
Hmm.
It was just horrible to watch. And now we have all these other variants that they're saying are more deadly than 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 than,
Absolutely.
than COVID-19 itself. Like, what can be more deadly than death? You know what I mean? And
Absolutely.
so now, yeah, I'm fully vaccinated, but I'm still like, I'm 6 feet, honey. I'll grab my
That's
mask.
right.
Everything. As soon as I get
Everything.
in the house, I'm washing hands.
That's
You know,
right.
if I go out, I had to run to the store a little bit, so I'm not going to get near my bed until I take these clothes off and get a shower.
Right. That's
Just
right.
stuff like that. I'm always cognizant of. And had it not been for the fact that I had to, jump on and do the show, first thing I do when I get home, strip clothes,
Strip clothes,
shower,
take a
take
shower.
a scrub,
Yes.
and then I start getting moving about my house. But then I invested in this air UV thing that the hospitals use to clean their
Yes.
air.
Uh-huh.
Works wonders, because I have my baby, my grandbaby, she has asthma. So I make sure I keep my air in my house clean. Um,
Yes.
my air conditioner is always set at a certain temperature. Yes, if you come to my house, you're probably gonna need a sweater. Period. Period. Don't ask me to turn my air conditioner down, up, or off. I'm not gonna do it.
Okay.
Period. Bring your sweater, a jacket, or a blanket, and some socks. You know. so, but I'm always cognizant of making sure people that come in, you're vaccinated, or you can tell me you haven't tested positive. I have hand sanitizer. I have the temperature, the UV temperature taken gun. I have
Hmm.
all of that sitting right there.
That's
You
right.
know, you can't wear your shoes in my house. Anybody
Uh-huh.
knows me, they know that's a given. So you have to still take extra precautions. I don't think that we should get so relaxed until we just throw all the rules away
Mm-hmm.
and just go back before our pre-COVID days.
Pre-COVID, right?
Yeah,
No,
I don't
no.
think we're ready for that.
No, we're a long ways, um, from that. As long as people, are out in the public, they're not properly wearing their mask, they're hanging down their nose, or they're not properly fitted. You want
Hmm.
it. You don't want no gaps.
Right.
And I just see it all the time, and if it gets to the point that it's too many that I
Yeah.
see, I would just wait.
Yeah.
I'll go home and I'll order it
Hmm.
and have it delivered
Have it
and be
delivered. Yep.
happy.
Yep. And let them knock on the door. I'm just like, leave it at the door.
That's
You
right.
know, your tip is going to be when I pay for it, I'm going to give you your tip then. We don't have to
That's
have
right.
no contact at
That's
all.
right. That's
You
right.
know, and I think sometimes people get offended, you know, because I'm quick to tell you, could you move back some, please? I don't have a problem with asking for my space now. That's something I do not have an issue with. I
Hmm.
will ask you, I don't care who you are. It doesn't matter, black, white, green, purple, yellow.
That's
I
right.
don't care. Could you please move back some? You're too close
That's
to
right.
me, you
This
know,
is your
or
health.
if I'm not in a real fancy, you know, hee ha ha kind of mood, I'll just like, I'm looking on my phone and I'll be like, you know, they're still talking about social distancing.
Uh huh.
I'll just kind of say that out loud, like I'm reading it off my phone. And then the person will be like, oh, I'm sorry. You know, or sometimes people will not move. And I'll say, could you please move back from me? That's what I'm trying to get you to understand. Move. Then they'll go,
Hmm.
oh, you know, some people get offended.
They
I
get
don't
offensive,
care.
but this is your health.
Yep. And
They're
my
not.
life.
They're not taking care of your body. You
Yep.
are.
Yep. And my life. So,
That's
my
right.
Bev, let me ask you this, and then I'm going to get ready to let you go. What would you tell anybody? First of all, it's going to be like an ABC or AB question. What would you tell anybody that think they may have COVID, but you're not sure? Let me let you answer that one first, because you thought you had bronchitis,
Get
and
tested.
so you probably you may have, you know, been able to get treatment a little bit earlier had you
Absolutely.
thought, maybe this might be COVID. So if you think you have symptoms of what might be COVID related, what advice would you give people?
Get tested.
Okay.
Even if you have to go every day or every other day, get tested.
Because you were doing self tests at home and your
Yes.
tests were coming back negative.
Negative.
Yeah. But you
Hmm.
were still in that, what did you call that, incubation
Incubation.
window period? Okay.
Hmm.
And how long is that?
It's anywhere from 10 to 14 days.
10 to 14 days. So I could actually have it, but if I'm within that incubation window, I still might test negative.
Right.
Okay.
You can test
Okay.
negative, but you can still transfer it. You can
Okay.
still pass it to someone else.
Okay. And that's what was happening with you. You were in that incubation period. So
Yes.
therefore, you were testing negative, but you actually had it.
Actually had it.
Okay. I
Hmm.
understand. I understand now. The second thing I want you to address before I let you go is once you get that positive um, diagnosis or what have you, what would be the first thing you could tell people to do?
To try to eat a healthy diet
Mm-hmm.
and make sure that they're practicing everything within their home as far as sanitation and to
Mm-hmm.
still self quarantine.
Okay.
I mean, it is so hard when you're home. You
Mm-hmm.
know, you need to stay in that room. You
Okay.
know, I got that room phobia too. You know, I get
Yeah.
it.
Yeah.
But if it's going to save the next person's life,
Mm-hmm.
you know, stay in the room and sterilize, clean. You know, get
Mm-hmm.
your Lysol, your microban, your bleach,
Mm-hmm. Mm-hmm.
um, and just eat healthy. You know, go back to our what we grew up with, or our
Yeah.
foreparents. You know,
Mm-hmm.
that's why they bounced back. You know,
Yep.
they ate healthy. They did not eat processed foods.
Mm-hmm. Mm-hmm.
You know.
And I think that's because we're not just this generation, but I've seen older women just lazy, don't want to cook no more, you know. And
Hmm.
I'm sorry to say it like that, but it is what it is. And
Hmm.
a lot of times we're so quick to just grab something, you know. Um, I have a company called Food for Thought. Our motto in that company is when you know what's going into you, when you control what goes into your food, you control what goes into your body. And so it wasn't until I was first diagnosed with brain tumors. And then after my first brain surgeries, I started changing the way I eat. So for about 4 years now, I've been really on this eating natural, eating plant based foods, stuff like
Hmm.
that, you know. Um,
Hmm.
and I promise you, it has really helped me not only physically but mentally as well. And
Mm-hmm.
that's my segue. Uh, COVID is also a mental.
Yes.
It I won't say it gives you mental illness, but well, in some cases, I've heard people say they develop mental illness behind COVID.
Mm-hmm.
What was your biggest mental battle you faced? And then what could you tell the audience about how to maintain their mental health going through COVID? Because that's got to be a strain on your mental. Uh,
It is because I'm a very I'm a compassionate, passionate, affectionate. So I'm that touchy, feely. I want to pat you on the back. I want to give you a
mm-hmm,
hug. And when you can't do that no more, it's like it's like the end of the world. It's like you don't think that nobody loves you or
mm-hmm,
anything, but you want that nurturance.
mm-hmm,
You want to be on the receiving end to
mm-hmm.
someone to respond to say, hey, I'm going to pat you on the back to let you know I got your back. I'm here. I'm supportive. But
Mm-hmm.
it's just a simple touch. Human touch means so
Yes,
much.
everything. To
It means
me, it's
everything.
everything.
Yes, it
Yeah,
is everything. And without it, people get lost.
yeah.
People just
Emotionally and mentally, you mean?
yes.
Yeah, yeah, yeah. And I can imagine that has to be. I remember my son, he had a seizure at work during the height of COVID. And um, he didn't even realize what happened. So when he woke up in the ambulance, he thought someone was kidnapping him.
Oh wow.
And so I go running to the hospital, and they wouldn't let me in to see him because it
Mhm.
was at the height of COVID.
Mhm.
Well, I parked in the parking lot of the hospital, and I sat there until um, the doctors were calling. They were allowing me to see him on FaceTime and talk to him, and he was so out of it. He just kept asking me, what? Why I'm here? What are they doing to me? He couldn't remember because he had a
Mhm.
seizure at work.
Mhm.
And I just kept thinking. And then while we were at the hospital, they have the entrance to the emergency room here. And over here off to the side, they had this huge, I promise you, it looked like something out of a movie. They had this huge tent
Mhm.
that they made like a makeshift hospital. And they had these these um, pipes and stuff coming from there with air going in and
They're going out.
ventilators and all kinds of stuff. And you pull up
Mhm.
to the hospital, the parking lot is completely lit up. It looked like a movie scene from
Mhm.
a science fiction movie. And I
Mhm.
sat there in total wonderment. And I'm like, God,
What's going on?
what's going on? People were trying to go in and see their loved ones. They were turning
Couldn't
them
do it.
around at the emergency door.
Right.
One lady, she just sat on the ground. Just she couldn't go in with her husband. She literally sat on the ground. Just I was like, Lord, what
And
is
that's what
this?
and that's the part that breaks the heart.
Mm-hmm.
People are heartbroken because you
Mm-hmm.
can't go in.
Yeah.
Even when my father had his inpatient stay, his pastor wanted to come and a couple of the deacons. They couldn't even come. He said,
So
"But I'm a pastor and we can go." He said, "No, you
so I'm
can't
wondering if
come."
they have um in staff clergy that are going around or praying with people of faith
They, they,
or
they, they are so overworked. I had one come to me once
Mhm,
to pray and just to talk. And this was like I think my second day in ICU.
mhm.
And I requested another time, but they were so busy because people were just literally dying all day, all night, having codes. So, they're with those families. So, they're just stretched.
That was another thing we talked about last night. You mentioned to me how um psychological how psychologically strenuous it was being in the hospital, hearing them call codes just about
Cold after
24
cold.
hours a day.
Yes, yes.
Did
And
you
the
ever
one that got,
wonder, am I going to get called? Am I going to code next? Like,
hmm, you have to learn how to tune it out.
mm-hmm,
You just have to learn. And then by then, I finally was able to get my headset
okay,
to my phone
okay,
and put my music on or a
mm-hmm,
sermon on
mm-hmm,
so I can drown that out
yeah,
because that was beginning to affect me negatively.
mm-hmm.
You hear that, your heart rate goes up. The
Oh,
nurse is running in, you're okay. I'm like, I'm fine. But if y'all call one more code, it's going to go up again.
right, right, right. I
you
can
know,
imagine. I can only imagine being in that setting. No one can come in. You certainly can't go out.
no,
The only physical interaction you're having is with nurses, and you don't know these people.
you
These people
don't.
don't know you. They know you by a chart. They
That's
don't know you
right.
by your heart. They don't know you by your kind spirit. They don't know anything about you except for what's on a chart. you
That's
know
right.
and that's not a relationship.
It's not.
you know
But at least it's another person that you could talk to.
yeah,
'Cause you can tell, there was a couple of people that were in housekeeping. They were very laid back. They were very spiritual, number one, and they could, like minds can
yeah,
connect,
uh-huh,
and you kind of develop a bond
wow,
with that person. So, with me there, that helped.
mm-hmm,
But when they were younger, I couldn't relate.
yeah,
We think different.
mm-hmm,
Our minds don't interact
mm-hmm,
the way that you would think in
mm-hmm.
this situation.
So let
They're
me
trying, but it's just difficulty because they don't have time to train staff
yeah,
on sensitivity of the people that are there.
yeah.
It's just tough.
So I would imagine then we can't really hold these doctors and nurses, and the techs these days to the bedside, manner, that we expect normally under normal circumstances, because these these days and months and years have been anything but normal. Let's
That's
just be
right.
honest. This is not normal. This is
That's
not
right.
something we want to keep living with. I sometimes I hear reports, well, this is never going to go away because every time we think we got a hold on it, here comes another variant, and then you
Hmm.
got another group of people that's saying, oh, it's already gone away, so everybody gets loose and fancy free and start ripping and running here and there. Then boom, you see the numbers spiking again. So we're almost in a catch 22 of even the information we're getting. You don't know what to believe. You got conspiracy theories. You got people that,
Absolutely.
it's so much. It's so much that we have to take in and decipher through. But I think the best thing is for everyone to do what's best for him or her.
Right. And my thing, you said a lot when you were talking about misinformations,
Mm-hmm.
conspiracy theories. You have to learn how to shut down social media
Yep.
or not watch it
Yep.
because you're going to be caught up in a whirlwind trying
Mm-hmm.
to figure it out.
Mm-hmm.
And in the long term, you're going to be doing more damage than you are good to
Yeah.
your body.
Yeah.
So, pray first, ask for
Yep.
revelation,
Mm-hmm.
eat healthy,
Mm-hmm.
mask up,
Mm-hmm.
keep sanitized,
Mm-hmm.
and when you come home, do the right thing in the right order.
Yeah.
It's a lot. It's tiring.
Yeah.
Cleaning your bathroom, some people every other day,
Yeah.
or your kitchen, your high traffic areas. If
Yep.
you can't do anything but wipe it down.
Yep.
If you can't, you jump out the shower, spray your shower
Yep.
with some disinfectant, and
Yep.
keep it moving.
And like you said, it's tiring. It can be, um, after a while, it just seems a bit redundant. They keep having to do this, but it's necessary during this
It
time.
is, but you know
It's
what?
necessary.
And this is funny. before they start hoarding all of your cleaning products. I'm like,
Hmm.
what did these people do before? You know, we
Right.
clean.
Weekly,
I
we've
have to clean
always
my
used bleach.
house.
We've always used Lysol.
Okay. Lysol, bleach, Comet,
Bleach, all of
My
it.
mother even used vinegar and baking soda. Oh, we
Exactly. I came up in a military household. So, and my mom was, she was in management and hospitality. Honey, we had to clean um,
oh
baseboards.
yes,
We had to do all of that. Bumper
all of
screen
that. Oh
cleaning.
yes,
We did bumper
yes.
screen
Look,
cleaning
we
year
took the
round.
toothbrush and cleaned the grout in the
Yep,
bathroom.
yep.
Okay.
Yep. So I don't know. Like you said, well, what did y'all do before COVID? How was y'all cleaning before? How were y'all bathing before?
But we were healthy.
We were healthy. We were healthy, and we did not have all of this to worry about. Mama Bev, I absolutely thank you for coming on and
Yeah.
sharing your story. It won't be the last time you'll be my guest because we do want
Okay.
to see some of um, your
That works.
your work that you've been doing, working on, and hopefully we can get you some orders coming in.
I hope so.
Um,
That would be awesome.
Again, yeah, and I'm so glad you're doing so much better. Um, it was such a pleasure when you called last night,
Yes,
because a lot of
yes.
times people don't think that strong people need people. You know,
Yes, you do.
I'm not of that belief. You know, if that's what it means to be strong, I want to be strong no more.
Okay.
I just want to be a regular Bonita.
Okay.
In the words of Cardi B, just a regular schmegula.
Regular. That's right. That's right.
But we need people. We need one another. Thank you all for tuning in and staying with us tonight. Thank you so much, Instagram, Facebook, Periscope, Twitter,
Yes.
and YouTube. Thank you all for tuning in. Mama Bev, again, thank you so much for sharing your story. Is
Thank you
there
for having me. It
anything?
was my
Oh, it's
pleasure.
my pleasure. Is there anything closing you want to say to the people, COVID, non COVID related, or whatever? Anything you might
I
have on your heart?
always say, follow your heart,
Mm-hmm.
believe in yourself. And if you get an inkling that something's not right, it's not right. Follow your first mind.
Yeah.
But whatever you do, always be wise and always be conscious of what you're doing and
Mm-hmm.
your surroundings.
Yeah.
And whatever you do, stay safe.
Yeah. Yeah. Yeah.
Whatever it takes, stay safe.
Thank you, Mama Bev. Thank you.
You're
And
so
remember,
welcome. And I
guys,
love your audience.
thank you. They're the greatest. They're the greatest. They are absolutely the greatest.
Okay.
Instagram, you can't really see them, but they can hear you.
Oh,
I think,
good.
yeah. Instagram is the only one that won't let you live stream to them from another platform.
Right.
Because they're their own little entity or whatever. But you can live stream directly from Instagram, but not
Mm-hmm.
to Instagram. So that's why we have everything set up the way
So
we
many
have it.
cameras.
Yeah, yeah. It's a whole production going on over here. But
Okay.
yeah, one day I'm going to give the audience a behind the screen look again. I did it once before when I was first setting up everything, but now, you know, uh, bless God, I've come so. It's been 2 years now, and I've acquired so much stuff here. So, so that's why I have really good lighting and all of that. So we thank God
Yes.
for that, and I'm just grateful to be here to serve. You know, um, as a content creator, as a commentator, as a life coach, certified master life coach. Um, just and to be here to be a listening ear and to give an open platform where we can have these discussions. And
Yes.
so again, thank you so much for coming. And you guys, Mom Bev, if they want to just get in touch with you, how can they get in touch with you?
Well, I am on Facebook under my regular name, Beverly King. You can follow me there.
Hmm.
Um, I think it's Princess BJRN on Twitter.
Okay.
And the other platforms, I couldn't tell you. That's old age, honey.
Right, right, right.
But I'm always checking Facebook, so the best platform will to is engage with me there.
Yeah.
Or if you want to email me, you can email me at bev.j.king.rn@gmail.com.
All right. Thank you so much, Mom
All
Bev.
right,
And listen,
thank
audience,
you.
you guys have been absolutely phenomenal as usual. And Mom Bev, we'll see you again. I'll make sure I touch bases with you before I go in surgery
Okay,
Wednesday. So we may
okay,
talk again tomorrow or
okay,
early Wednesday morning while
okay,
I'm en route to the hospital. Okay.
okay.
All
Sounds like a
right, Mom.
plan. I love
Love you
you.
so much.
Love you too.
Bye bye.
Bye bye.